April of 2019 as the first hire for data governance, and I fairly quickly over the next 6 or 8 months built a small team out. And we started with the things people typically do. We built a website. We developed a intake and a RACI form for how to engage with data governance. We wanted to have clear processes, standards, etc. We also in September that first year began a search for a data catalog. At the beginning of this conversation, Caitlin was talking about heading down that journey, and I thought or I hoped it wouldn't take as long as it did, but they do. They're complicated, and it takes a while to go through and understand, what are the needs and how can we be served by using other things. Well, how about using SharePoint? There's lots of ways to handle it that you don't necessarily have to buy an off the shelf system, but they certainly do help. So we are implementing. In fact, on May 5th, we went live with our data catalog. It's kind of a soft launch for us, but proud to say that that initiative has come to fruition. We started an enterprise glossary, and we also did a benchmark, and we looked at HIMSS AMAM. We actually looked at a lot of different places to benchmark our governance program. And one of the things we did was wanted to make sure that it didn't just look at governance, because if you do a good job at managing your data and having good quality data, then there's an uplift in your reporting. There's an uplift in many other aspects of the organization. So we chose HIMSS AMAM to benchmark us. It looked at 4 areas of our organization, and data governance was just one of them. So we started off with our first assessment. It's a 7-stage assessment, 0 being the lowest and 7 being the highest. And our first assessment had us squarely pegged at a stage 0. And we kind of expected that. We had a long way to go, and we'll talk about that a little bit in more detail here in a minute. But we started a reporting metric glossary, which we've now got almost 500 metrics in there today. That's governed metrics with numerators, denominators, owners, AKAs, etc. We had our final data governance hire in February of 2020, and we stood up in June of 2020 a thing called a data release review council. And I'll get to that slide in a little bit and go into a little bit more detail. But in lieu of a data catalog and being able to discover where data was, I was new to healthcare. And data lives in a lot of different places. And one way to know what was most important was to make sure that we had good, clear understanding of the data that was leaving St. Luke's. So we'll get into what that council is, but it's been a very powerful team and recognized as a good win here. We did develop a capabilities model and had the system accept. It was years of implementation, probably 7 by multiple people, some of which aren't here anymore. But the capabilities model is what the organization does, and it takes away some of the geography or organizational structure and allows you to focus on what the organization does and make sure that you've got the right people involved when you do mature your data governance organization and stand up stewardship teams. We developed a data governance playbook, and we did that during COVID when we couldn't engage with a lot of the rest of the organization. It's really our framework and our blueprint for how to manage data. There's 8 elements that are best practices in data management, and not all data is created equal, so not all data needs to go through and be rationalized against those 8 elements. But we have that playbook so people can look at it and we can reference it to say, are we asking the right questions, and do we have the right things identified to make sure that we do have good data, good standards, policies, procedures, practices, etc. We started our first data stewardship team in September of 2021. It was a big milestone because, data governance program really isn't complete without data stewardship. They're yin and yang to each other. And we've got 5 teams up now. We'll get into what those are in just a little bit, but that was a big milestone to get that first one going. It took a lot of work, a lot of effort, and, finding the right people to engage with who are also passionate about data helped. We did create a policy and procedure for data governance, and we have that in our official repository. And then moving into January 2022, we started an employees patient data work group. But really, it's just a group of people that it's a cross-functional group of people throughout the organization. I'll get into some of the structure in a little bit more detail here in a minute, but it's anytime you take employee data and put it with patient data, there's laws and guidelines and rules that we have to follow. So this group is just to help make sure that we're following those, that we've got a review process in place, and that we're just being good stewards of that data. Anytime we do need to mix it, and there are cases we do need to mix employee data with the employees of patient data. And we had a third HIMSS assessment. We did select a data catalog in September of 22. We went with Calibra, lots of choices out there, lots of good ones that you could choose with some competing interests, but we ended up going with Calibra and have been pretty happy with the selection there. Training that they have and the work group, the community work group is fantastic. And then in October, we started another, we call it cross-organizational data sharing, and we'll talk a little bit more about that in just a minute too, what that is. But these are some work groups that the data governance team helped facilitate as needs in the organization were identified and brought forward of, hey, we need some help making sure that we're managing these processes. We need some help making sure that we've got them written down and documented. And so, with those partners bringing those things forward, it enabled us to stand some of these teams up. So I'll get into those in just a second. And I'm going to back up a little bit just to the high level journey. And you can see over here on the left that we've got a data governance community of practice. It's our formal steering committee made up primarily of senior leaders throughout the organization. We've got nursing and patient services, cybersecurity, compliance, legal, supply chain, clinic administration, rev cycle, just a whole list of people who are part of that, and they provide guidance, support, direction, and an escalation path if there are data issues or policies that we need reviewed. So we started with that. Then we have a data governance center of excellence, which is really my team. And from that, we then took, and I talked about a little bit ago, creating a data governance playbook. This is just one of the slides from it, but there's 8 areas of managing data, and all these arrows are intentional because there is no one right or wrong place to start. And there's no necessarily stopping place for identifying what assets need to be tracked for what data element. Sometimes just knowing who the owner is good enough. A lot of times you do need a standard and a definition, maybe a policy and procedure on, what does the data quality look like? How do you update it? Who has the ability to approve it? How does it fit into the data architecture? What's it related to? Do you need to have any metrics and reporting to ensure that the processes you put in place are proactive and that you're effectively change managing it? So all of these are things that we have in the playbook and go into greater detail on how to just all the things you need to consider when you're talking about a data asset and how to make sure you're managing it appropriately. And then once we had that, we did start up stewardship teams. We have 5 up and running now with 2 more, possibly 3 more on deck to get started. And again, that stewardship is the yin and yang relationship to data governance. You really need them both to propel your program forward. So just a quick view to our structure. We have myself up here. We have a domain architect who is responsible for the capabilities model and helping to ensure that our data catalog is used and successful. We have 3 analysts. One is in charge of clinical data stewardship. One is focused on business data, and the other is focused around compliance and data security. We deal with, being a health system, we deal with a lot of personal information that we, I think every organization has this, but, we just have to make sure that we're following certain guidelines, and there's some standards and a lot of government regulation that we have to comply with. So we just want to make sure that we're on top of all of that. So we've got a person focused on that. And then from this team, that their day job is data governance, we help support all of these other functions and teams within the organization, and I'll get into some of these in just a second. I'm going to talk a little bit about stewardship and some of the things that we have been able to do at St. Luke's with our stewardship, some deliverables. One is that we created a healthcare practitioner taxonomy, and it sounds fairly simple, but you know, what does it mean when we say the word physician? Is it just people that have MDs that are doctors? Is it nurse practitioners? What about residents? And what are advanced practice providers? Well, who's a clinician? A lot of times we'll use those words interchangeably, and in the data, you could see that we didn't have any firm structure or standards associated to who a practitioner was. So we took one of the stewardship teams took this under their wing and went through, and we got rid of 41 provider types that were not necessarily needed. We realigned hundreds of providers' data and made sure that the right providers were associated to the right workflows so that when they were seeing patients, they could log the right data. So we did this cleanup and we built a one-to-one relationship, and we ran it all the way up to the top of the organization to have it approved. To be clear, when we say the word provider, this is what we mean. It's either a physician or advanced practice provider. And there's additional details that people can see that we built a mapping for, and we built a change control process around it to ensure that that data can get entered without running it through the stewardship team. So we built a whole process around maintaining the quality of this data once we went through and did the cleansing of it. So um, it's a pretty good win, and it seems like a simple one, but you've got to start with some things that, where you can get wins, and it really isn't that simple because titles mean a lot to people. It's important, and we needed to be very clear on what constituted, what standards went into the difference between an advanced practice provider and allied health professional. Anybody who's worked in healthcare realizes that there's tons of standards out there, and for almost everything you have, there's no one standard. Even the government doesn't provide a one standard on things. There's a lot of times you have multiple standards that you have to try to conform with, and so you need to have a good understanding of your data. And the next thing I want to highlight is that we worked with a few teams, a security team, to go through and build an association between the name that's printed on our badges that gives people access in St. Luke's to certain areas of the company. We built an association between the organizational structure hierarchy and what actually gets printed on badges. They were not connected before, or they were loosely connected. It was human glue. We built a process that if there is a new department created, we'll go ahead and update a list, and then we send it to the security team and they can make sure that the right name gets printed on the right badge. And it's important if you're a patient and you're in a hospital, you're in a clinic setting, you want to know what that person does that you're talking to. And you can look at their badge and see what their role is. So we wanted to make sure that patients could clearly understand the names. And we had that on most of the badges before. It was some of the administrative type people that we really needed to go through and do some cleanup on. So we've built a process around ensuring that anytime there's a department change that we proactively update the roster and list, and it's one of the wins for us. And the last thing I just want to highlight is that from the time we stood up our first team, we've got five total stewardship teams now stood up that are functioning on a mostly biweekly basis and tackling some of the data issues that we have. We've got a organizational data, we've got a provider data team, one that's focused on patient data. Location is important. Patients need to know how to get to locations, and we have we have multiple facilities that exist on two streets because they've got two entrances, and how do you make sure that you're conveying that properly? And if you update the name on a clinic, how do we make sure that if you walk in a lobby and you look at a list of where things are located out in the building, that's also been updated. So we're trying to bring that all into a process that ensures that all of our location data is proactively maintained. We've found through the stewardship team location data in 9 different data sources maintained by at least 9 different people. So our goal is to build a process around to create a golden record or a standard of which we can change manage any changes to location data going forward. And the different systems have different needs, so some of them are very valid for different locations. We're starting just with patient facing location and trying to go through and cleanse and make sure that that's clean and clear so that people can find us. And I think those are the ones that I kind of wanted to highlight, in places where we were able to look at gaps in the system and be able to work with people that had identified them. So all of these, the name on the badges and the practitioner taxonomy, came up from issues that people had brought forward, or we helped a facilitator realize that, hey, there's a problem here, and it does need to be solved. And so we really just aligned to real world cases that would help solve some problems for our system. And one of the things that we started was a data literacy newsletter. We've done 6 so far. Um, you know, who here on the call decides what doctor they want to go see based on their data proficiency? And hopefully nobody raises their hand, because when you go see a doctor, you want to see them either as just a general checkup, or you're looking for a specialist, whether it's cancer or whatever. You're looking for those credentials for a certain provider that you want to be seen by. You don't come to them and say, hey man, I hope you're good at your data. I hope you are very data literate. You have the ability to read and write in context. It's not everybody's priority to be able to be incredibly data literate, and that's a good thing. We want our providers to be able to focus on patients, but we also want to send the message that there are teams here at our organization that our job is to be focused on data. And if you're facing problems with data, or if you're doing something and you have questions, that there's teams of people that you can reach out to. So this literacy newsletter, we just release it quarterly. We always try to tie it to an event happening at the time in the world that people will be able to relate to in the news. And again, we just want to make sure that the audience at St. Luke's, that the people that our employees are able to understand that, if they do have questions on data, they can reach out, because we do have a pretty good team of data warehousing, master data governance, and our BI report writing team, our whole IT team that helps support the whole system. There's a lot of other actors within the MSL and informatics team too that help out, but we just want to make sure that people understand, if you're frustrated with data, there's some outlets and we can help. So that's what we do with our data literacy newsletter. We have a thing called the Data Release Review Council. This is really the first organization that we stood up, and it was early on, recognizing that we had just started the search for a data catalog, and it's hard to understand what data you need to govern if you can't discover it. And this team had, one of the purposes as a governance person, selfishly, was that as we go through and look at the data elements that are leaving the organization, it'd help us understand what matters, what's really important. Um, in HIPAA, there's 18 PHI data elements. Okay, those are outlined. You can easily see what those are. But what about the rest of them? What matters? So we set up this team. It's a very powerful team. We have a privacy officer, a sourcing director, information security. We've got legal. We've got compliance, finance, IHT, cyber. HIM, which is health information management, so patient records, all as members of this team. And the purpose is, anytime data leaves in mass, not associated to a patient's record, but anytime data leaves in mass for something, this team rationalizes and validates that the data going is appropriate for the request. And we make sure that all the contracts are signed, that all the T's are crossed and the I's are dotted. We've got over 200 right now that we've approved. I haven't updated this slide. This is from late last year, December of 2022, and we just started putting some metrics around the release review cases. We're actually up over 400 cases overall. But anytime data goes this outside the organization, this team looks at the requirements that the engagement has, and we validate that the data going is appropriate. And we've developed a policy and some guidelines around it. And one of them is that optional data doesn't go unless St. Luke's has a need, unless the business sponsor says, hey, I need the data to go. We don't rationalize the business sponsor. We don't second guess why we're doing the engagement. Our focus is really on the data and ensuring that what is leaving, that we have a traceable repository of the who, what, when, where, why, and how, so that we can audit it. And we ensure that every few years, we've got a cadence that every 3 years, we have to review these in accordance or in line with their contracts as they get re-signed, so that we're always making sure that the data that leaves is appropriate. And probably 50% of the cases we've changed, and it's been reduced, the data that's leaving. We've created some guidelines which has helped. The number here says DRC approved with modified. It's 17 and approved with no change is 32. About half of the cases that we have that we see we approve without making changes to. The other half we make changes to. We're impacting less and less because people are becoming more and more aware of things that we will or won't let leave the organization. So some people come to us and, oh, we read your guideline and, we've removed, this data element from going. We're not sending birthday anymore. We're sending birth month or age. So there's things like that help put a focus on data and help make sure that we've got the right people together. And this is a team that has decision-making abilities to approve or deny requests for data. So it's been a really powerful team that has got a lot of traction. And then just a call out to something, how we're driving some change in the industry. Back in 2019, CMS's OASIS, if you have any buddy or if anybody's on Medicare, it's a database that CMS requires because they're paying for your health care. So they require certain information. Well, this database no longer is a 2019 required Social Security number. It said, hey, you can send MRN instead. And nobody at our EMR or any other health system who used it had realized or had the chance to look at and say, hey, we no longer need to send Social Security number. As this team was reviewing that case, as that team was reviewing that request, we noticed that Social Security number was going, and in the requirements document, it was an optional data element, which per our policy says we don't send it unless the business side says, hey, it has to go. We need to send this because we cannot be wrong. And Social Security number in that case cannot be wrong. So we worked with our EMR, and in the next few weeks, they're supposed to come out with a fix to no longer send Social Security number for those patients to OASIS, which it's a government, it's a federal government database, but they recognize that they're prone to a data breach, and as part of that, they didn't need people's Social Security number. The MRN was fine. You can go back to the health system and find out who the patient is if you need to, but they didn't need Social Security number. So soon, this will go into effect not only for St. Luke's, but it'll go into effect for any other health system that uses the same EMR as we use. So it's one of those kind of cool. Yeah, go ahead.
When creating that data set, is it fully automated or are there manual interventions in the creation and the review of that data that goes out?
It depends on the data set. We do catalog we inventory who reviews it before it goes for quality, who approved it. And as much as possible, we'll interact with the appropriate either data warehouse or BI or IHT teams to automate as much as possible. We also look at the interface, how is it transmitted? Try not to make it secure email, but believe it or not, we still have a few that are secure email, SFTP, or directly through different type of, there's other automated ways that we can send data, and we do try to influence people to send data in more secure, automated manner.
Thanks.
Yeah, you bet. Okay, so any questions on we call it DRRC for short, but on the Data Release Review Council?
Volume. How many of these occur in a month in orders of magnitude?
We review probably around 6 per month.
Oh, okay. That's not high volume.
It's not super high volume, but every one of them is incredibly detailed. because we have to look at our existing contracts and see if it's in breach of any of our other contracts that we have with other people. And there's a lot that goes on with some of these. So while they're not high in volume, they're usually, if you look at the data that's going, they're data rich.
So it's your payers and the government entities, probably.
Yeah, any of the government entities, anybody that we engage with to do business that isn't involved in like direct patient care, right? A patient needs this, that's the HIM department. They take care of that. But this is data in mass, and payers would definitely be one. Registries where we're trying to benchmark and, hey, who else is seeing a patient that has similar um, you know, problems that they're presenting, and the provider can reach out and talk to that other provider to say, hey, how did you treat them? And they can just at least discuss the cases and figure out, if there's some similarities in how they can treat a patient. So we don't touch on any of that individual stuff. It's the data in mass. And
So other
there's
than
quite a
stripping
few.
out the social security number, is there de-identification that happens during some of these processes?
There is on some of them.
Yeah.
We do de-identify some. We strip out social, and social and birth date. Those are those are the data elements we're very sensitive of, but we're sensitive to actually all 18 of the HIPAA ones. And then even just some of the PII data elements, we really just look at the overall content and just try to make sure that we're being good stewards of our patient data. Because if you hear of a data breach somewhere, the last thing we want to have happen is a patient say, well, oof, I'm safe, I didn't have any of my data there, and then come to find out that, yeah, you did. Um, if it's there, we vetted it, we're, completely covered, we're doing the, the right thing by the organization. We can't prevent somebody else from having a data breach. But, this council does the due diligence to make sure that we've done everything possible to ensure that the data that they do have is appropriate and they don't get any extra data.
Yeah, I don't want to hog the whole conversation, but it seems like a lot of like benchmarking doesn't need to know the ID at all. They just need to know it's an individual with some one-to-one referential integrity constraint, like a hash or something like that. So,
Yeah, exactly.
cool.
Exactly. Yeah, we look
All
at
right.
that.
Thanks for the insight.
You bet.
I'm surprised it's only 6 a month. I would have thought hundreds, but
Yeah,
I guess.
we've got over 7,000, we've got thousands of contracts, I guess, but a lot of them are involved in either direct pay, so patient to patient, and that's not our scope. Our scope is data over 100 people to go. So that minimizes our area of influence, because when it is direct patient to patient, you'd need that,
Sure.
likely you need that entire medical record. We're more data in mass.
Troy, I have a question. How did you guys come up with that over 100 people? Like, how did you guys determine as a group that was going to be your scope?
Loaded question. It took us months of kind of back and forth and refining our process of what was in scope. We really struggled. It took us over a year to get our initial scope defined and approved up through our leadership teams. And then about a year or so later, as we had cases come through, we were able to further refine our scope, and we made some tweaks to it. I'd be more than happy to share, how we defined what's in scope and what's out of scope. But it took us quite a while to get to that. And we chose 100, and it wasn't necessarily arbitrary, but our cyber team looks for data leaving the organization, and they had set 100 as a threshold. If somebody sends something and it has X records in it, it'll flag it for them to either review or help validate that something didn't just leave accidentally, or it's also part of a HIPAA requirement. If you have certain number of records leave and they're exposed, if it's over 100, we have to report it. So we were able to kind of center in on that, but it took us a little while to get there. But that's how we chose 100.
And that's really cool. That's really helpful. Yeah, we're trying to get like our executives bought in. I'm at a smaller startup company, but yeah, I was just curious because that's what we're trying to tackle right now, right? And there's a lot of back and forth on what we think we should look at or what we don't. Yeah, it's interesting.
It was hard. It was really hard. And just to get some of the buy-in to collect the who, what, where, when, why data. But now that we have a repository going, people now come to us and say, hey, do you have a record of all the, people that we do X kind of business with? And we'll try to go through and classify it. And, we're finding in some cases we don't. And so we'll pull those into the process. Or if somebody has a process like, if we have a student engagement with certain universities, we've got an entire other team that approves those engagement. In our process documentation, we have, if this is what you're looking for, here's a link to these people's process. So we've really built a place that people can go to look if data needs to leave, or if they have questions around how do I get something approved. You can go to this Data Release Review Council and see our process, as well as the 4 or 5 other ones that we've identified that people could engage with to ask questions to. But getting the scope clear and what was in scope and out of scope, it was hard. And we do ask people if you don't know, bring it to us and let's have a conversation, and we can figure out if we need to add it or not.
Yeah, I love that.
Okay, I'm going to go on to the next one. This is something that we call as Employees Patient Data Work Group. Again, it's another place where we recognized in the organization, and I use the word we, people inside St. Luke's, not just governance, but there was a real use case for making sure that whenever we took employee data and put it with patient data, we had made sure that we were, have the right releases been signed? How long was the release good for? Are we compiling the right data? We always want to make sure that we're doing the right thing and being good stewards of the data. So we have a work group that meets monthly. We cancel the meeting if we don't have any agendas. We have an intake process. We have a form that people can help fill out. We invite them to the meeting to have a conversation around whenever we put data together. Some of it's federally mandated. You've got to get a flu vaccine if you work in a health system, and you've got to show that you have it, or you have to have an exclusion. So we have a report on that, and that's taking employee data and putting it with your personal health record data. So that's one of the cases. There's several other ones that we go through and do and just rationalize and make sure that are we doing the right thing? And if yes, are we making sure that we're sending the right data and not any more data than we need to? So that's this team's purpose. And then this is a newer one for us. This is, we call it cross-organization data sharing. It is a new work group or team that we've set up with decision-making abilities. We've got data warehousing involved because they get a lot of requests, and the BI team, our report team, to send data. Hey, send me this data. We've got master data management. We've got our chief operating officer from the St. Luke's Health Partners, which we call a different entity. So St. Luke's is a health system that has a health plan now and a health partners organization that's more focused on well-being of care, but they're 3 different entities. They have 3 different missions, and there's many times that the data can't be it cannot be commingled. It's not even on the same server. Different, you can't even have access to it. Different people. So we have different organizations and different missions, and this team helps make sure that we're doing the right thing, that we're ensuring that when data moves from one org to another org, that it is indeed appropriate, and that, for example, if Blue Cross asks for data, or, some other, Kaiser or whatever asks for some information, that we're not going to give that same information to our internal health plan that we wouldn't give to somebody else. So this team rationalizes all that to help make sure that we're just, again, being good stewards of that data. We've got a vice president of the Health Partners organization on the team, senior compliance director, deputy legal counsel, HIM. So this truly cross-functional team that reviews and rationalizes those requests. And we did just create our first data sharing policy. So we didn't have one before, and that was very hard to create because trying to find a health organization that had a data sharing policy, I reached out to a few of them, and everybody I reached out to said, let us know when you have one, would love to see it. So we created one. we're working on some appendices for it that get into detail when one entity shares it with another entity, that kind of outlines some use cases and workflow, when it's okay to and when it's not okay to, and when you need to ask a question. Because this team has an intake process that if people have a question, they can bring to it, and it can be discussed, it can be documented and understood, what decision was made and why. And our primary goals are ensuring that we're always in compliance with HIPAA, antitrust laws, that any third-party contracts have been evaluated and that we're not in breach of that, and that our reputation is managed appropriately. Every organization cares about your brand, so these are the main things that we kind of keep focused on, and it's really all about the data. But it's one of our newer teams that we recently stood up, and getting a data sharing policy in place was a big win for us, a big step forward. Okay, just some of the accomplishments. We've got 10 policies established on some of the data management, and they get into a little bit more detail. So who's a provider? Like I talked about the provider types of providers, there's titles of providers, there's transformation tables in between, there's the management of it. So we've got a policy on that. How patients are impaneled, it's a healthcare term, but to providers. It happens after a patient sees a provider, but we've got a policy on how that happens. So it's clear and transparent to somebody, well, why is this patient showing up as being one of mine? So we're just trying to help with transparency, consistency, making sure that we've got standards in place. So we've got 10 policies so far. We've got 171 externally released data requests rationalized. The number's probably closer to 200 now. I need to update the slide. We've got over 684 governed enterprise metric terms in our glossary, where we have business owners, technical owners, and AKA. It's something that somebody can go through and look at to see, does a metric already exist, and am I able to use that? Our goal there is to ensure that if somebody sees a metric in one report and they see the same name metric in another report, you don't get two different answers. So 684 is feels like a pretty good number for us, and we're adding to it, probably 40, 50 a month, either a definition or a metric. We did also go through and partner with several other teams and created a provider data mart to help manage and master some of our provider data. It comes from multiple different systems, and sometimes you don't know which one's right. So we went through and identified and worked with bunches of people to create a data mart that can be used through reporting. And if people have a question on where a provider is practicing out of, you can go to this data mart, and this is kind of seen as our source of truth and how we're trying to help manage the data and build some processes around making sure that we're proactively managing it, and then where possible putting some automation in place so that we don't have so much human glue. We have a lot of human glue in our data systems today, and definitely look for those opportunities to automate where possible. And next is our HIMSS AMAM achievement. I'm just focusing on the data governance portion here. As an organization, we started off at a stage 0. Right now, we're probably around a 4 or 5. We're expecting to submit for our results from our last assessment here in the next week or so. But the data governance went from a 0 to a 91%. So super proud of all of the team that works, with, and that we have to work with at St. Luke's, and the people that report directly to me, to my team, put a lot of work and effort into getting it up to that 91%. We do have the 5 data stewardship teams created, 2 more on deck. Privacy and security hopefully is coming, and one that deals with service lines. We have 6 data literacy updates done. And then we've got 1,600 views on our SharePoint site. And for a health organization, it's quite a few views because it's not something that, a nurse or provider is typically going to go looking for, unless hopefully they're having a problem with data, or, something's not right. And they're looking for some help. So is some of the key, go ahead.
Oh, I do have a really quick question. So when you were talking about your policies, what I've noticed in the past, at least my previous life, one of our challenges was you can create the policies, but then getting them right enforced is a totally different ball game. Same with like the definitions. How do you guys kind of handle that today to make sure people are using data and following the policies as they should be?
Good question. What we do is we've started with most of these as their education, and we didn't put enforcement in some of them. I didn't put in here, but we created a record retention policy, and we're now doing a data retention. We're doing some revisions on it, but just to get it across the finish line, we had to be clear that this wasn't, that what we have on the policy wasn't, didn't have any, consequences if you don't comply with it. We're just trying to get it around awareness and training and start with that. So we socialize it. We will put something out on our intranet so people can see it, and then we'll send emails to try to notify people of it. But our approach has truly been to start with just create the policy first and let it be discovered and aware, and then to come back as time permits and try to put some enforcement and teeth around it. For some of the ones that we did, we tried to put enforcement in, and it just opened up a whole other can of worms. And we realized weren't going to get it across the finish line anytime soon, any of them really. So our approach has been, let's just start with awareness first and get that out there. Hey, we have a policy, help make people aware, get it in front of them. So that's been our approach.
I love that. That's really cool.
Okay, and then just the key takeaways, just to have a good data governance program, you need executive support. If you don't have it, it's really hard to get a grassroots program going. You've got to find your partners, or you've got to find and partner with your allies. There's other people out there in the organizations that you deal with that care deeply about data and would consider themselves data geeks. They're not everywhere, and they might not even be in the highest priority that you think you need to go after. But find those people that are willing to partner with you, and together you're stronger than you just trying to do something on your own. And in my organization here, it's heavily involved with legal and compliance, and cyber tend to be really good partners. We have a lot of shared interests. And then, another key takeaway is just look for obtainable wins, even if it's not your priority. One of the stewardship teams we have, all of our stewardship teams are built around subject areas except for one, and even one of the other ones coming up is not going to be, but most of them are around our subject area model that we created. But a couple of them are around projects that the organization has identified that we stand some stewardship teams up around. And then once that project is done, we'll move it over to and probably create a new stewardship team that's associated to a subject area, and just make sure that it's not a one-time project that we're trying to steward some of the data on, if that's not the case, but build it into a true stewardship where you cleanse it, you manage the data, and then you bring it into a process that change manages it going forward. And then just some of the challenges that we faced, and I think you face this everywhere. I mean, my prior organization faced these same challenges, but just building the relationships and breaking down the data silos takes time. There's a slide I saw at a presentation once that it's called data mining. Somebody saying, hey, it's my data, and it shouldn't have to be that way. If you don't take the data with you when you leave your organization, it's not your data, it's the organization's data. And shame on the organization if they put one person on the pointy end of the hook to make sure that it was secure and taken care of. And it happens a lot more times than I think we would like in any industry where you see that. So, our
Amen.
goal is just our goal has been to go ahead.
Yeah, I was just seconding that. The number of times that I've seen people fired for a mistake, or looking behind a curtain they shouldn't. And I think we can do better than that as data professionals to prevent that, to be more proactive there.
Yeah, that's helping people realize that this shouldn't just be your problem, and don't, maybe somebody told you it was, but it shouldn't be. It's not fair to that person. So breaking down those silos, building that trust, and bringing them into the process where they have a seat at the table to make decisions, and don't lose any power, right? If somebody doesn't like it on a stewardship team, it's great, bring those perspectives in. Very rarely have I ever had in my 10 years or so of being in data governance had an issue that had to be escalated. The team couldn't make a decision on when you put it all out on the table, and you take your department hat off and you put your hat on that says, hey, company name here. When you look at it through that lens, I can think of twice that we've had to escalate things in probably 10 years at this organization and my prior one that the team couldn't agree on, where we needed some guidance and support to decide which way to go. But it's definitely one of the challenges. And then human generated data is much more challenging than machine generated, and that more automation you can get in place and that source of truth that takes it from here and moves it out to the other sources, the better off you are. Having 9 independently maintained data sets for location is a lot. It's a lot to ask of people. And some people put a period after ST in street, some people spell out street, some people don't put a period, some people capitalize it. All those things in data, when you pull it in, shows us a different data element. So partnering with our master data organization and just trying to build standards around data is definitely a challenge.
Sure.
And then yeah,
we have about 4 minutes left, and we have 3 questions coming in.
Okay.
So is this your last slide?
It is. This is it.
Okay,
And
cool.
I'll just say then it takes, it's a long journey and it takes dedicated resources. I've heard of other, there's lots of places that I hear about people trying to do governance as a part-time job, and good luck if you try to do that. And with that, I'll take questions.
Okay, on that point, your dedicated resources, is that your data stewards? Are they in IT or the business? And I think you said you have 5 and might add another 3 or more. Is that right?
The data stewards are all in the business and they're not part of the data governance organization. I have 4 people on my team, and we're the facilitators and orchestrators of those stewardship teams.
Okay. And does governance include master data management?
It does, yes.
Okay. And the last question, how do you evaluate data catalog tools like Calibra, or why Calibra? Like, maybe a way I'd ask this, will you share your evaluation matrix?
Yeah, we used Gartner's as a foundation. We made a few tweaks that made it healthcare specific, but we took the Gartner evaluation and it's really thorough, and we made some modifications to it. But yeah, I'd be more than happy to share what we used for ours, but it started with Gartner's.
Very good. Well, one comment. Yesterday at the Idaho CyberSec ITC event, Idaho Technology Council, there was a bunch of St. Luke's people there, as well as practically everybody else. It was basically a who's who of CyberSec people in the state. And St. Luke's was well represented. They attended my speech on enforcing your access policies. And so Caitlin asked that question, and I'd offer to give that talk 40 minutes to anybody if they wanted to hear it. Taking those policies and moving them into your engine. Go ahead, Tom.
We always love to hear from you, Mike.
Put you right to sleep.
No. Hey, Troy, this is Tom Barrio. Hey, just great job. Really, really impressed with the progress and the journey you guys have been on. And you mentioned the data stewards. Roughly how many of those folks do you have? And did they start out as data stewards, or were they called something else?
They're all called something else. They all have day jobs, but they're all the people that really care about data and understand what happens if you mess it up.
Yeah.
We've probably got, I'm going to say 70. We do have a roster that we have them that people can look up. Wow. Who's your steward? But we've probably got about 70 on the 5 teams.
Nice. And do the data stewards, do they utilize the MDM tool, or how does that MDM tool tie into the data governance process?
We haven't got it probably fully integrated yet. We do have master data on the teams that we have, and we'll bring it into what they're using as part of the automation or part of creating a golden record and helping develop standards and profile the data. And so that's how they're kind of brought in, but there's not a direct tie at this point. We have a really small master data team.
Okay. And may I ask which tool you're using for MDM?
Prophecy.
Oh, yeah, okay, cool. Familiar.
Okay. We have time for one more question if it's short. Well, thank you, Troy. I really
Thank you
appreciate.
for having me. Yeah.
Yeah, I appreciate getting a little visibility into the state's largest employers' successes, but also your a few of the warts or challenges, right? That's always valuable to see, where you've had to overcome and challenge your team to be resolute in their journey, because it's never done, is it?
Never. List
All
is
right.
huge.
Well, thanks again. Reach out to us if you want added to this list. And in future topics, look for the date on Bill Inman and his visit. And then we have a data literacy probably that will push to July. And other than that, thank you for always being faithful to attend these. I find great value in them, and tell your friends and encourage them to join as well. We'll see you in person next week, and thanks again, Troy.
Thanks, everyone.
Bye-bye.
Great job, Mike. Thanks, Troy. Good job. Bye.
Thanks, guys. Bye.